Common cardiac meds. The treatment of hypertension is known as A, B, C, and D. A is angiotensin converting enzyme inhibitors as ACE1, angiotensin receptor blockers, B is beta blockers, C calcium channel blockers, and D diuretics. ACE inhibitors are high blood pressure medicines that widen or dilate the blood vessels to improve the amount of blood the heart pumps and lowers the blood pressure. If the patient develops angioedema, then they may receive angiotensin receptor blockers. They have the same effect as ACE inhibitors. It's just another type of blood pressure medicine, but works by a different mechanism. Beta blockers block the effects of the sympathetic nervous system on the heart. You need to watch for bradycardia or bronchospasms. Calcium channel blockers work by slowing the movement of the calcium into the cells of the heart and blood vessel walls, which makes it easier for the heart to pump and widen blood vessels. One of the side effects would be constipation. Diuretics. For high blood pressure, diuretics help the body get rid of unneeded water and salt through the urine. Getting rid of excess salt and fluid helps lower blood pressure and can make it easier for the heart to pump. The antihypertensive drugs like ACE inhibitors, they end in pril. Angiotensin receptor blockers end in ARTANs. Beta blockers end in alol, and calcium channel blockers are very nice drugs, which stands for verapamil, nifedipine, diltiazem. Inhibitors work by blocking the action of some of the hormones that help regulate blood pressure. By stopping these hormones from working, the medications help reduce the amount of water in the blood and also widen the arteries, both of which will bring the blood pressure down. ACE inhibitors are not suitable for pregnant or breastfeeding women, people with conditions that affect the blood supply to their kidney, or those with a history of heart disease. ACE inhibitors has been known to reduce the supply of blood to the kidneys, which can reduce their efficiency. So blood and urine tests may be carried out before they start taking ACE inhibitors to make sure that there are no pre-existing problems with the kidneys. Annual blood and urine tests may be required if they continue to use ACE inhibitors. The side effects to include dizziness, tiredness or weakness, headaches, and a persistent dry cough. Again, the worst side effect is angioedema. Now, most of the other side effects should pass in a few days, although some people find they continue to have the dry cough. If the side effects become troubling, then they may switch to an angiotensin receptor antagonist. ACE inhibitors can cause unpredictable effects if taken with other medications, so it's important that you teach the patient to be sure to say what all medications they are taking, including over-the-counter medications. Beta blockers used to be a popular treatment for high blood pressure, but now they only tend to be used when other treatments have not proved successful. This is because beta blockers have more potential side effects than the other medications that are used to treat high blood pressure. Beta blockers work by slowing down the heart rate and force of the heart. This reduces the pressure at which the blood is pumped out of the heart and around the body. Common side effects of beta blockers include tiredness, cold hands and feet, slow heartbeat, diarrhea, and nausea. Calcium channel blockers work by relaxing the muscles that make up the walls of the arteries. This causes the arteries to widen, reducing the blood pressure. Calcium channel blockers are not recommended for people with history of heart disease, liver disease, or circulation problems. Side effects of calcium channel blockers include flushed face, swollen ankles, dizziness, tiredness, and rashes. However, these side effects should pass within a few days once the body gets used to the medication. The patient should not drink grapefruit juice if they're taking calcium channel blockers because this can cause a drop in the blood pressure. The diuretics, thiazides, loop, and potassium sparing. Thiazide diuretics work by reducing the amount of water in the blood and widen the walls of the arteries. They are not recommended for pregnant women or people who have gout. Thiazide diuretics have been known to reduce the level of potassium in the blood, which can interfere with the heart and kidney function. They can also raise the level of sugar in the blood, which could lead to diabetes. A few people have reported that they could not get or maintain an erection while taking thiazide diuretics, but this particular side effect is resolved once the medicines are withdrawn. Loop diuretics. This causes extracellular fluid depletion, and the salt balance in the bloodstream sometimes becomes upset, which can cause a low blood level of potassium, sodium, magnesium, and a high level of calcium. These effects may cause weakness and confusion. Potassium-sparing diuretics. Potassium-sparing side effects include numbness or tingling feeling, muscle pain or weakness, uneven heart rate, feeling lightheaded, and be sure to monitor the renal status, checking whether or not they are urinating or if the urine has decreased. Antiarrhythmic medications are split into 4 categories. Class 1 antiarrhythmic medicines are sodium channel blockers, which slow electrical conduction in the heart. Class 2 antiarrhythmic medicines are beta blockers, which work by blocking the impulse that may cause an irregular heart rhythm and by interfering with hormonal influences such as adrenaline on the heart cells. By doing this, they also reduce blood pressure and heart rate. Class 3 antiarrhythmic medicines slow the electrical impulses in the heart by blocking the heart's potassium channels. Class 4 antiarrhythmic is similar to Class 3, but by blocking the calcium channels in the heart. Digoxin is another example of a medicine that can be used as an antiarrhythmic, although it is not included in the above categories. Because each class of medicine works in a slightly different way, there is no one medicine to treat every kind of arrhythmia. Sometimes an antiarrhythmic medication can cause more arrhythmias or make the arrhythmia even worse. The most common interactions would include medications like Coumadin. May need to reduce the amount of Coumadin that the patient is taking. May also need to reduce the amount of digoxin. A nursing assessment is needed to determine how the body reacts to insulin or oral diabetes medication. When taking certain kinds of antiarrhythmic, the skin can sunburn more easily. And the skin can continue to be sensitive to light for several months even after treatment stops. So it's important to teach the patient that they may get sunburned through a window or cotton clothing. If they are going to be out in the sunlight, they need to wear sunscreen. And grapefruit. The juice inhibits intestinal enzymes and decreases drug metabolism. So do not use grapefruit juice with felodipine, nifedipine, amlodipine, and verapamil. And all of those are calcium channel blockers. Other drugs that grapefruit juice should not be given with carbamazepine, buspirone, and lovastatin.